The greatest health crisis of the modern era is not announced by alarms or measured only in hospital beds, but unfolds silently in bedrooms, classrooms, workplaces, and city streets. Because while humanity has learned to map the genome, transplant organs, and eradicate diseases once thought unstoppable, more than 1 billion people across the planet now live with mental health conditions, making psychological distress one of the most widespread and least visible challenges of our time, one that cuts across borders, cultures, and economic systems, and yet remains profoundly misunderstood, underfunded, and often ignored. Mental health struggles do not discriminate by geography or income, but they do reflect the pressures of the world people inhabit, a world that has become faster, more connected, and paradoxically more isolating, where constant exposure to information, comparison, and crisis leaves little room for rest, and where the demands of productivity often collide with the human need for meaning, stability, and belonging, creating conditions in which anxiety, depression, burnout, and trauma flourish quietly beneath the surface of everyday life. For many, mental illness does not arrive as a single moment of collapse, but as a gradual erosion, a persistent sense of exhaustion, numbness, or fear that becomes normalized over time, especially in societies where emotional resilience is expected but emotional vulnerability is stigmatized, and where admitting psychological struggle can still be perceived as weakness rather than a natural response to prolonged stress, uncertainty, or loss, reinforcing cycles of silence that prevent people from seeking help until their condition becomes severe. The scale of the challenge is staggering, as mental health conditions now represent one of the leading causes of disability worldwide, affecting productivity, relationships, education, and physical health, and placing immense strain on families and communities. Yet mental health services remain deeply unequal, with access determined largely by geography, wealth, and social status, leaving millions without adequate care, particularly in low- and middle-income countries where resources are scarce and mental health infrastructure is minimal or non-existent. Even in wealthier nations, systems struggle to keep pace with demand. As waiting lists grow, services are overwhelmed, and treatment is often fragmented, reactive, or inaccessible to those who need it most, revealing a fundamental mismatch between the scale of the problem and the seriousness with which it has historically been addressed, and exposing the lingering legacy of treating mental health as secondary to physical health rather than as an integral part of overall well-being. This imbalance is compounded by rapid social change as traditional support structures weaken under the pressures of urbanization, migration, and economic instability, leaving individuals more isolated than previous generations. And while digital technology offers new forms of connection, it also introduces new stressors, from social comparison and cyberbullying to information overload and constant surveillance of self-worth through metrics of likes, views, and validation, reshaping how identity and self-esteem are formed, particularly among young people. For children and adolescents, the mental health crisis is especially acute, as rising rates of anxiety, depression, and self-harm reflect the strain of growing up in a world marked by academic pressure, social media scrutiny, climate anxiety, and uncertainty about the future, often without the emotional tools or institutional support needed to navigate these challenges. placing long-term consequences not only on individual lives, but on the social fabric of future generations. Mental health is also deeply intertwined with inequality, as poverty, discrimination, conflict, and displacement increase vulnerability to psychological distress, while simultaneously limiting access to care, creating feedback loops where mental illness both results from and reinforces social disadvantage, trapping individuals in cycles of marginalization that are difficult to escape without systemic intervention, and highlighting the reality that mental health is not merely a personal issue, but a societal one. The economic cost of untreated mental health conditions is immense, measured not only in healthcare spending, but in lost productivity, strained social services, and reduced quality of life. Yet framing the issue solely in economic terms risks overlooking its human dimension, the quiet suffering of individuals who struggle to function, to connect, or to find hope, often while appearing outwardly composed, and whose pain remains invisible until it manifests in crisis. Despite growing awareness, stigma remains a powerful barrier, shaping how mental illness is perceived, discussed, and treated, particularly in cultures where emotional expression is discouraged or where mental health conditions are misunderstood as moral failings rather than medical realities, reinforcing fear and shame that delay treatment and deepen isolation, and demonstrating that progress in mental health requires not only clinical solutions, but cultural change. In recent years, global events have brought mental health into sharper focus as pandemics, economic shocks, and geopolitical instability have exposed the psychological toll of collective trauma, forcing societies to confront the limits of resilience and the consequences of neglecting mental well-being, and prompting renewed calls for investment, integration, and innovation in mental health care. From community-based services to digital interventions and preventative approaches. Yet technology, like all tools, presents both promise and risk, as digital mental health platforms expand access and reduce barriers for some, while raising questions about quality, equity, and the replacement of human connection with automated solutions, underscoring the need for careful balance between innovation and compassion, and reminding us that while technology can support care, it cannot replace the fundamental human need to be seen, heard, and understood. Addressing the global mental health challenge requires a shift in perspective, one that recognizes mental well-being as foundational to social stability, economic resilience, and human dignity, and that treats prevention, early intervention, and sustained support as essential investments rather than optional expenditures, because mental health does not exist in isolation, but reflects the health of societies themselves. Ultimately, the growing prevalence of mental health conditions is not simply a sign of individual weakness or modern fragility, but a signal, a collective response to a world in transition, and how societies choose to respond will shape not only health outcomes, but the moral character of the age, determining whether suffering continues to be hidden and endured alone, or acknowledged openly and met with empathy, resources, and shared responsibility, in recognition that caring for mental health is not an act of charity, but a measure of collective progress in an increasingly complex and demanding world.